Good morning. Good morning. I'd like to welcome everyone today. After a very difficult 2 years dealing with COVID, along with the usual challenges of a top-tiered medical provider, we are delighted to pause this morning for a celebration. We have good reason to celebrate and recognize some of our outstanding providers, educators, and colleagues. I want to thank you all for coming and acknowledging these outstanding UAB professionals with us. At this time, I would like to ask Dean Harper to come and bring greetings from the UAB School of Nursing. Dean Harper.
Welcome to the School of Nursing. We love having you here. We love hosting you, and we're excited about this morning. And I want to thank you for taking time out of your day to join us to help the Alabama State Nurses Association honor outstanding UAB nursing faculty and nurses and other healthcare professionals from UAB Medicine for their selfless dedication to education, practice, and patients. I would only say I have a little pride because there are a lot of UAB nursing alumni in this group also. And I stand in awe of all the providers and educators who have confronted the challenges of the past 2 years strategically and through innovation and have continued to lead through these extraordinary times. You all that are being honored today represent the best of UAB. And I could not be prouder to call you colleagues. So congratulations and thank you to everyone who's joined us here today, from all of your colleagues at the School of Nursing, and certainly from everyone here at UAB. Thank you.
Before I introduce Dr. Lindsay Harris, who will present each award, I just want to say that we have almost 4,000 nurses and an army of support staff, physicians and professionals here at UAB every single day to do this work. Personally, I want to share just a minute. In 1983, I came to UAB to come to nursing school. I'd researched schools. I'm from Lee County, so I'd researched schools across the state. And I came here because of the reputation of the faculty and the clinical experiences. Through the clinical rotations that you do as a nursing student, I quickly learned, especially through the ED at UAB, that this is also where I wanted to work. It was because of these types of stories that we're going to hear today that really made me want to be here. It was because of award-winning professors, amazing nurses and doctors who do heroic things as a team, alumni both from the school and the hospital who continue to help the community even after retirement, and team members from UAB who served in state and national positions. I knew this about UAB over 30 years ago and where I wanted to end up. It took me 23 years to get here. I came back to UAB for employment as well as to the DMP program. It was all because of these stories that were still alive then when I came back. Through the pandemic, if you watch the news every day, it was us. It was nurses and students fighting the pandemic. It was faculty leading teams into the hospital setting, physicians working arm in arm with nurses and other professionals to do amazing work. The stories of heroic efforts continued. I'm humbled today to be asked by the ASNA to say a few words at this award ceremony. I thank you for that opportunity, and I'd like to now introduce Dr. Lindsay Harris. Dr. Lindsay Harris is a UAB nurse, and she's the president of the Alabama State Nurses Association, and she will present the awards. Dr. Harris?
Good morning, everyone, and thank you, Dr. Poe. I definitely agree 100% with your sentiments. This morning is truly a time to be thankful and celebrate the achievements of these outstanding members of the UAB family. Before presenting the awards, I want to give a brief explanation of how these awards were established, how the recipients were selected, and why these awards represent the highest ideals of medical practice, preparation, and execution. Each year, ASNA presents awards in 12 categories to nurses, nurse educators, and providers across the state. The categories include titles such as Outstanding Mentor, Advocate, Nursing Practice, Nursing Educator, Healthcare Organization or Unit, and many more. Of these 12 categories representing excellence, 7 are being presented today with UAB staff. ASNA has over 3,000 members and represents the interests of nurses of all specialties in the state. Several of these are member-specific, but most are not. These recipients are nominated by peers across the state and selected by an ASNA awards committee who carefully vets and scrutinizes the nominations. The whole process takes months, and most importantly, arises from a peer-to-peer source. Some of you may not be aware of the fact that ASNA arose from a group of nurses who saw the significance to codify nursing practice into law, establishing nurse licensure standards. This group advocated and passed the first Nurse Practice Act in 1913, about 109 years ago. We have that original document in our office at ASNA in Montgomery. Along with advocating for our code of ethics and scope of practice standards over years, ASNA has been the hub of nursing, recognizing those who exemplify the highest ideas of character and practice in our profession. As I said earlier, of these 12 that are recognized across the state of Alabama, we are honoring 7 from the institution UAB in just a few minutes. Also, I wanted to tell you about a new award that we will be presenting for the first time today. Inspired by the extraordinary sacrifices made by nurses and providers during the pandemic, ASNA has established the new award. It is deemed as the highest award given by the organization in its 109-year history. The award is the Nurse Legion of Honor Medal. During the pandemic, we saw many parallels in courage, commitment, and sacrifices of nurses to the same character qualities in the bravest soldiers in our military history. Therefore, the Nurse Legion of Honor Medal was established to mirror the criteria of the Medal of Honor for the bravery and sacrifices in our military. Like the Medal of Honor, the Nurse Legion of Honor is given to only a few. Like the Medal of Honor, it is posthumously to the families or units, or presented to those who are still with us. Like the Medal of Honor, it is crafted with the highest quality of brass and gold and may be treasured by recipients and family. Although all nurses, like soldiers, in many respects are heroes. Like the Medal of Honor, the Nurse Legion of Honor is given to one who has demonstrated extraordinary courage in the face of risk not normally associated with the profession. This award and all of these awards today are screened and selected by their peers. At this time, we will begin our presentations. The first recipients are receiving 2 awards. They are receiving the ASNA Annual Outstanding Nursing Practice Award, and each will receive a Nurse Legion of Honor Medal. Would India Alford and Sherichia Hardy please come forward? India Alford and Sherichia Hardy responded and provided nursing to an individual in the field following the Fultondale tornado in January 2021. The patient was entrapped in a heavily damaged environment with structural wrist. A life-saving field amputation was completed. Ms. Alford and Ms. Hardy demonstrated exceptional courage and nursing support to the physicians and family during this time of a natural disaster. Thank you. While India and Sherichia are down front, I think it would be appropriate to remain and have their picture made with those next to award recipients. Would Doctors Reiff and Courtney Blayke Gibson please come forward? Together, you are receiving the Outstanding Medical Practice Non-Member Award. As we've said, nurses, Alford and Hardy, participated in this effort and ensuing system innovation. So please join in for the photo with Drs. Gibson and Reiff. Dr. Gibson and Dr. Reiff responded and provided a medical care to an individual in the field in Fultondale. The patient was entrapped under a heavy environment with structural risk. A life-saving amputation was completed. Drs. Gibson and Reiff demonstrated exceptional courage and medical support to the patient and family during this time of natural disaster. Thank you all. Now, I would like to invite Dean Harper to stand with me as we present the state's Outstanding Nurse Educator Award. Again, we have received nominations for individuals across the state for this award who serve as nurse educators. In fact, our ASNA Awards Committee was chaired by a nurse educator from School of Nursing in a southern section of the state. As with the other awards, there are many worthy nominees. I am proud to announce that the Outstanding Nurse Educator Award goes to Dr. Loretta Lee from UAB School of Nursing. Dr. Lee is an associate professor at the University of Alabama at Birmingham School of Nursing and is a board-certified family nurse practitioner. This year, Dr. Lee was recognized as a UAB Visionary Leader and Graduate Clinical Faculty of the Month. In addition, Dr. Lee is on the editorial board of Ethnicity and Health, an international academic journal that focuses on the relationship between health and ethnicity. In addition to her superior teaching, Dr. Lee is also actively involved in numerous scholarly activities, including publications, presentations, and participates in many service initiatives. Congratulations, Dr. Lee. The next award recipient received a both UAB award and ASNA award recently. During the pandemic, many retired nurses answered the call of duty to return to work or volunteer their services. Would Deborah Thedford-Zimmerman please come forward? Given the fact that there are hundreds of UAB alumni and the challenges of the past year inspired many people to volunteer, this honor is worthy of a special recognition. Deborah Thedford-Zimmerman was selected by the UAB National Alumni Society as the Volunteer of the Year. Deborah Thedford-Zimmerman is the immediate past president of the Birmingham Black Nurses Association. She is a member of the National Black Nurses Association Membership Committee and serves as the chair of the Chapter Development Committee. Ms. Thedford-Zimmerman has been awarded several grants to offer community food and education drives, COVID-19 financial assistance for older adults, meals for health care workers, and recognition for area nurses. Her continued focus is on healthcare screenings, education, and service to varied culturally and underserved groups. Thank you. As Deborah said, she has received her award during the convention. Last but certainly not least, ASNA Outstanding Healthcare Organization or Unit Award. Imagine the difficulty our committee had in considering the accomplishments of units across the state during the pandemic. With so many worthy contenders and extraordinary challenges presented by COVID, this award is very special. The award for the Outstanding Healthcare Organization or Unit goes to UAB Hospital Emergency Department. You're welcome. The University of Alabama at Birmingham Emergency Department provided medical and nursing personnel to care for an individual in the field following the Fultondale tornado in January 2021. The patient was entrapped in a heavily damaged environment with structural risk. A life-saving field amputation was completed. The dedication to superior emergency trauma care by UAB ED is commendable. Thank you all. I would like to thank Doctors Terry Poe and Dean Harper, and all of you for participating in this celebration. Dean Harper, if you would please come and give any closing remarks.
Everything has been on Zoom so often that I'm getting used to classroom behavior again. First of all, thank you, Lindsay and ASNA. We are so proud of the leadership that Lindsay is exerting in the state and that ASNA has kind of put forward. It's been very exciting to watch that happen. And to be able to share this experience with you all here at UAB this morning is even more exciting. And I will say, thank you for recognizing some of our UAB Medicine colleagues, our School of Nursing faculty and alumni who have had and continue to have an incredible impact on healthcare and patients and this community. Congratulations again to everyone who is honored today. We are so proud of you, and thank you for representing our school, the university, and health system so well, and for your continued impact on healthcare. We count on you. And thank everyone for being here today to recognize these outstanding colleagues. And again, join us anytime. We love to host you, and we love to be a part of your work. So thank you.